Let's head on over to the Eastern Cape now, where Premier Lubabalo Mabuyane has briefed the media in Bhisho to provide a status update on the work being done by the province to fight COVID-19. My colleague Yanga Funani does have an update for us. Yanga, very interesting to hopefully get some word there out of the Premier. Are you seeing that the response has been quite avid and active?
Very good afternoon to you, Arabil. Well, you heard for yourself from the Premier. He was giving us a detailed report on how the province is performing in as far as capping the spreads of the virus is concerned in the province. One will remember that the province currently is standing at 2,000 daily new infections, which really sum up to 14,000 per week. He was briefing the media, telling us that he has put in place a project management unit which will really give support to the office of the SG at the Department of Health. One will remember that the province has been battling in terms of dealing with the health department. Now, he spoke really seriously into the issues of management in that department, saying that the introduction of the PMU is to really give support because it is headed by the chairperson of the Portfolio Committee on Health, Dr. Sibongiseni. But to tell us more about the briefing by the media, by the Premier, is the spokesperson to the Premier, Mr. Mvuswekaya Stretcher. Mawawa, thank you very much for joining us. The Premier spoke harshly with regards to management of the health department. It has been the center of the criticism which is directed to the Eastern Cape. Tell us about this PMU unit.
The PMU unit is to focus on the administrative systems of the department, look at the COVID-19 capabilities, and that's the main focus of that team. It is to provide support to the Department of Health. It's not a takeover. The department is not under Section 100. One of the key things, for instance, is the team has identified a shortage of oxygen reticulation in hospitals. So we're moving with speed to address those issues. Labor relations matters in some of our hospitals are receiving attention so that you remove all the delays that are frustrating your procurement, issues of workers. All those things are being prioritized so that health workers are focusing on delivering healthcare to our people.
Okay, the other issue he raised were 4 areas of concern, among which the infection of the age group between the 40 and 80 and their deaths thereof. What is the province doing about that?
The movement of our strategy to ward-based areas is following those trends, because we are seeing that data shows that the people that are infected in that category are the ones that are mobile. And we're saying to those people, wear your mask, ensure that you only leave your home when it's the right time to do so. And we are empowering them with information that is going to help them. That's why the Premier was talking about the support group, which helps to encourage people, share information, empower each other. So we're saying to those people, when you are infected, these are the things that you ought to do. Make sure that you don't expose other people to infection. When you look at the number of people that have recovered, the 72% plus in the province, those people are an example of how you fight the virus. If you stay at home, if you adhere to the prescriptions of the doctors, the things that your health providers, your nurses are saying you must do, you're going to recover.
You also spoke about the issues of overcrowding in private hospitals, while there's really space in public hospitals of the province. But the problem with that is that they are under-equipped. What is the province going to do with that?
There's this general perception that private healthcare is the alpha and omega. We're seeing now a collaboration between private and public health systems, where a number of hospitals in the province, when they are overcrowded, they call public health hospitals. So the investment that government has made into the resources, the capacity of these hospitals, to point a few, the Nelson Mandela in Mthatha, Free Hospital, and the Cecilia Makiwan, it is helping everyone. Remember, our constitutional responsibility is to provide healthcare to everyone. So people that would normally go to private healthcare are now coming to get healthcare from public hospitals. So that partnership is also including work done by laboratories, private laboratories, so that we're working together to fight this virus. This is one of the things that are a cornerstone to the intervention that we're pushing as the province.
Okay. Corruption continues to derail whatever effort the provincial government is doing. 3 weeks back, you wrote to the SIU, to the president, requesting the services of the SIU. Any update on that?
When the president moves on that, he's going to announce a proclamation on that investigation. We need to respond to lies that are manufactured by people on social media, where they are using a story by the Dispatch, which they lost to the press ombudsman, where they were claiming the Premier was involved in some corruption. That was not the case. The Premier is not, and he has never been involved in any wrongdoing. And that's why today he's talking about the continuation of the fight against corruption, calling on anyone with evidence of any wrongdoing to report it to law enforcement, so that government is able to respond effectively to issues of wrongdoing. Because for us to fight the virus, to grow the province, we need to continue, and underline continue, fighting the scourge of corruption. The province is not corrupt. Yes, we have elements of corruption in the province, and we are identifying those, dealing with them. And we're saying to win this fight, we need all the people of our province to play their part by sharing the information. All these government institutions are here. If you don't trust this one, go to that one. Government is here to listen to the people. We've got an open, democratic society where, media is exposing some of these things. And those that we did not know, we follow them up when we pick them up from the media. So people have a responsibility. Let's all play our part. But in doing that, let's close space for people that are opportunists, who are throwing mud at individuals that they do not like, making unfounded claims and allegations. So we need to fight the corruption that we're seeing, but not to fight people claiming they are corrupt when they are not.
Lastly, before I let you go, Mawa, would the province submit if it were corrupt, or would it also submit if it needed help, especially during this time?
What do you mean it would submit?
Admit that...
okay. Look, we are an honest government. When there are things that we're unable to do, we call to national government to assist. Now, assistance in government, it doesn't jump to Section 100. We start with the IGR support, where, based on the resources that we have, we ask national government for additional resources. That's why you've seen the developments in the budgeting that the national minister has been making. That's why we continue requesting support in a number of interventions. The interventions that national government is making, they're not only new to the province of the Eastern Cape. In other provinces, national government is supporting people, is seconding officials, providing additional resources. That's the constitutional responsibility of national government. So when we request those, it's not that we are failing. We are not. We're doing our work. The Premier was showing you data of recoveries, that data, the screening, the testing, comes from the healthcare workers of our province. When we look at the value chain of the health system, we have identified where are the problems, and that's why the PMU is focusing there, so that you don't have a ripple effect to the operational side of your intervention. So once you fix the administrative side of things, every element is going to come together, and we're going to have a good health system that looks after the people, that provides the health services that are guaranteed by our constitution to each and every person of our province. So if we were to be in a bad situation, we would call to national government, but we are not in a position to be put under Section 100 administration at all. We reject that. It's an ill-informed perception by people who are probably looking for other things that are not there. And for civil society organizations that are raising, issues that are not there, I think they should just go to IEC and register to be a political party, to participate in the political space. Because when people make arguments, they need to base it on evidence and facts. We can't listen to people that are just excited to see things, to see what they perceive to be a situation in the Eastern Cape. We are not a Section 100 candidate. We are working with national government to address a problem. There is no government, state or national, that has ever prepared for a pandemic like this one. All governments are addressing problems as they see, because what you see today, it's not going to be the same problem tomorrow. It might advance, it might be something different. I mean, look at the states in America that have been reopening and going back to lockdown. So we have to work together to address all these problems.
Mr. Stretch, thanks a lot for your time. That's Mr. Mvusi Stretcher Arabile. The lion's share of it is that the province says it is no candidate for Section 100. Much work has been done. They say that there are at least 15 advisors who are looking at the administration of the province, and in its current form and state, it's nowhere near to be handed over to the national government. From us here in Bhisho, it's back to you in Johannesburg.
My colleague Yanga Funani, thank you so much for the time.